Continuing with Objective 5, we're going to define, pronounce, and spell diagnostic terms related to the digestive system. So we'll start with the terms built from word parts. Cholangiogram, radiographic image of the bile ducts. Cholangiography, radiographic imaging of the bile ducts. CT colonography, radiographic imaging of the colon. Esophagogram, radiographic image of the esophagus and pharynx. Capsule endoscopy, visual examination within a hollow organ, procedure that uses a tiny wireless camera to take pictures of the gastrointestinal tract. Colonoscope, instrument used for visual examination of the colon. Colonoscopy, visual examination of the colon. Esophagogastroduodenoscopy, visual examination of the esophagus, stomach, and duodenum. Esophagoscopy, visual examination of the esophagus. Gastroscope, instrument used for visual examination of the stomach. Gastroscopy, visual examination of the stomach. Laparoscope, instrument used for visual examination of the abdominal cavity. Laparoscopy, visual examination of the abdominal cavity. Proctoscope, instrument used for visual examination of the rectum. Proctoscopy, visual examination of the rectum. Sigmoidoscopy, visual examination of the sigmoid colon. Again, lots of exercises. So here are endoscopic views obtained at a colonoscopy. So figure A is a normal colon, B has diverticulosis, C has colon polyps, and D is colon cancer. What is barium enema also called? And it is called a lower GI series. And we will get to that in 1 second, so I apologize. So now we're going to look at the diagnostic terms not built from word parts. Abdominal sonography, ultrasound scan of the abdominal cavity in which the size and structure of organs such as the aorta, liver, gallbladder, bile ducts, and pancreas can be visualized. Barium enema, series of radiographic images taken of the large intestine after the contrast agent barium has been administered, also called a lower GI series. So that's a picture of that. Endoscopic retrograde cholangiopancreatography, procedure in which contrast media is introduced through an endoscope in the duodenum into the biliary and pancreatic ducts. Endoscopic ultrasound, procedure using an endoscope fitted with an ultrasound probe that provides images of the esophageal and stomach linings. Upper GI series of radiographic images taken of the pharynx, esophagus, stomach, and duodenum after the contrast agent barium has been administered orally, also called upper gastrointestinal series. Then a couple of labs. Fecal occult blood test to detect occult blood and feces. It is used to screen for colon cancer or polyps. Occult blood refers to blood that is present but can only be detected by chemical testing or by microscope. Helicobacter pylori antibodies test, blood test to determine the presence of H. pylori bacteria. The bacteria can be found in the lining of the stomach and can cause peptic ulcers. So what is an abnormal finding shown in this abdominal sonography of the gallbladder? So it's a condition of gallstones, which is cholelithiasis. In this procedure, contrast media is introduced through an endoscope in the duodenum into the biliary and pancreatic ducts. So that is the endoscopic retrograde cholangiopancreatography. And that will end this recording.